New South Wales has detected community transmission of the Omicron variant. Along with a new case in the ACT, it's the first instance of Omicron spreading on Australian soil. There are now 13 confirmed cases of the new strain in the state. Our reporter Ruby Cornish has been following the story and joins us now. Ruby, what's the latest?
Good evening, Jeremy. Well, just in the past hour, New South Wales Health has confirmed 4 new cases of community transmission of the Omicron variant. That means that now we have 3 school students from Regent's Park Christian School who have been confirmed to have been infected with this strain. All the staff and students at that school have now been deemed close contacts and they've been sent home for the rest of the year. New South Wales Health has also confirmed that the parents of a 7-year-old boy who became infected on a flight from Doha to Sydney late last month are also infected with this strain of the virus. Now, obviously, for people living in Regent's Park in Western Sydney, this has not come as welcome news. Testing clinics in the area were busy today. Just how the variant made its way into the city's west is still unknown.
Oh, it's going to spread everywhere.
I don't think it should be. Hopefully not too much of a worry.
What can I do? Lock myself in my house and be a hermit?
The state has recorded 337 new cases, the highest daily total in 6 weeks. But so far, hospitalisation rates and ICU admissions are not rising.
They are the numbers that matter. Case numbers in of themselves are only one measurement.
What we're seeing is people who either are asymptomatic or have very mild symptoms, generally.
Around the world, vaccine manufacturers are scrambling to understand more about Omicron. It's not yet known how much protection existing vaccines provide.
We are making a Omicron-specific variant booster shot now at risk. We're doing the lab work necessary. We'll get that into testing as quickly as possible.
There had been talk about shrinking the recommended wait between 2nd and 3rd vaccine doses. But this morning, the Australian Technical Advisory Group on Immunisation decided to keep that window at 6 months. That's with one exception. People who are severely immunocompromised are now being advised to get their booster 2 months after their 2nd vaccine dose. Ruby Cornish, ABC News, Sydney.
We're starting to get the first details over the transmissibility of Omicron, with South African scientists saying infections are growing at the fastest rate seen all pandemic. Presenting their findings from early investigations into the new variant, scientists say they've seen a 300% increase in new cases. South Africa was the first to report the new variant last week. It's now been detected in 30 other countries. Scientists say most cases appear mild, but there has been an increase in hospital admissions, the second highest in children aged under 5.
The trend that we're seeing now that's different to what we saw before is a particular increase in hospital admissions in children under 5 years.
Data is still being collected, but of those that have reported status, 23% in hospital current patients are said to be unvaccinated and 2% are vaccinated.
The World Health Organization is expecting to have lab data on whether Omicron can evade protection from existing vaccines within weeks.